Hi. Thanks for joining. Why did you guys come out? No reason? Just sitting here? That's it? No response? I have to tell you, if this is the way we're going to be, frankly, we're not going to get along for the next 2 hours or whatever the time is. So why did you come here?
Come up with techniques or ideas in terms of brainstorming based on
Something. Okay. Come up with techniques or ideas. I need to know what your expectations are, because it's very hard to fulfill expectations if you don't actually know what they are. Yeah.
What are the first things you look at when seeing a potential opportunity?
Okay. Okay. Anything else?
Trying to balance being creative and organizing that creativity with trying to come up with ideas. So there's techniques for that.
Interesting. Okay. I can answer your question though in the back right away. What's the first thing I look for to know it's a creative idea or a good idea? People saying no, it's dumb. Because if people like it right away, it's nothing novel. Well, I have some good news for you and maybe some so-so news. Because today, over the next little while, we are going to do something absolutely extraordinary. You don't believe me? You don't look like you believe me because you're just sitting there. I'm beaming because this is going to be the first for all of us. This will never happen again in your lives. This will never happen again in my life. This is a unique next 2 hours, one for those of you that are lucky, that you'll never be able to do again. Because we, as a group, collectively, we are going to innovate. Okay, that really met with a lot of excitement. Let me tell you what we are going to innovate. We are going to innovate the bed. The bed. Someone actually just about, yes, that's exactly the hospital bed. We are going to come up with something that is different, that is novel, and we are going to do that in slightly under 2 hours. Do you believe me?
yes.
Yeah. I didn't say we were going to come up with something great. Notice? Just different. So let's talk about innovation, or ideation is what we're going to be talking about. Why ideation? What is it? Why is it important? If we're going to innovate, why are we talking about ideation? First of all, who thinks it's a good idea that we're going to innovate? Okay, the one guy over here is not paying attention, doesn't think it's a great idea. The guy in the back, not sure about it yet. But so you don't know if you want to innovate? You don't want to be an innovator? Okay. Why?
Things aren't perfect, we can make things better.
Okay. Things aren't perfect. We can make things better. Okay, so what does it mean to innovate? Not all at once, please, because I get overwhelmed and it's really hard for me. Because all of you want to innovate, except for the guy in the front there, okay? The rest of you are ready to jump on this bandwagon.
Invent something useful and novel at the same time.
Okay, invent something useful and novel. Okay, who agrees with that? Or what's your definition? solving a problem, okay?
Disrupting the way things are done.
Disrupting the way things are done. Disrupting, not necessarily solving, okay? Something novel, an invention. So if I, for example, were to take a camera and put it in a different location, is that an innovation? Because it's not novel, it's not an invention, and it's probably not useful. But what if I were to tell you that the reason we have a pill that is a camera to look at your insides is because a doctor had a problem and got together with his friend who happened to be a bomb engineer who was working on really small cameras for guiding missiles, and who realized that he could use that camera in the form factor of a pill to look at your insides. So technically it's not novel. It's using the same technology in a different context. What is innovation? Well, I'm putting you out of your misery. This is just a working definition. And that's part of the point, is that we're all excited to innovate, but none of us are really quite sure exactly what that means. So understanding what we're trying to do together is important. The way I'm defining innovation here for us tonight is that it is developing something new, novel, or better that solves a particular need. It doesn't matter if you've created something amazingly new, but nobody wants it. At the end of the day, that's not really an innovation. It could be art, it could be something else, but innovation intrinsically, as we've come to sort of be preached at, is that it does something. It helps something, people want it. And it does not have to be new. A lot of people don't really appreciate the fact that, yes, we talk now about, because of Christensen, disruptive innovation, but there is also incremental innovation. And the reality is that by far the most innovative, the most impactful innovations are often small incremental steps of improvement, improving the way that people are sitting in waiting rooms, improving the way that documents are done online versus in paper form. Those aren't groundbreaking aha moments. Those are incremental steps of switching from a paper to an electronic device that we have around. It's not necessarily groundbreaking, disruptive, but it is a form of innovation. So my question to you then is, how do you do this? How do you make something new or novel?
I think you have to start by gaining an understanding of how things are done currently.
Okay. I honestly, genuinely am a huge advocate of that. So that I'm sure there are many, many other ways, but embedding yourself, observing, looking at the system, looking at what people are doing now is probably one of the best ways to start understanding where there are gaps. To innovate, you need to establish that there are gaps. Most innovations are not random. People see a need. People see an opportunity. And they find a way to address that need and opportunity. So we're told quite often, think differently. Problem solve. Be creative. So you identified your gap, you see an opportunity. Now, if you have a good gap, there are a whole bunch of different ways of thinking about it. It's a gap, if it meets with one person, one need, one time, maybe it's not worth spending $100 million trying to solve it, unless maybe it's Bill Gates and there he is willing to pay that money for you. That would be fabulous. Quite often, you want to look at market size, potential. You want to look at return on investment. You want to look at the size of the opportunity. So understanding a gap and picking, there are many gaps, especially in healthcare. If you hang around a hospital for any length of time, you will see gaps left, right, and center. Which to pick, which to select, that's a little bit more different, a little more difficult. So once you've selected something and you've verified it, what then? How do you think differently about it? That's part of the problem, is that you're all driven by the thing called the human mind. And does anyone know how it works? Not physiologically and in great detail. I mean generally. How does our mind work?
You become biased towards like these.
Why? I mean, that's exactly what I'm asking you. You're absolutely right. That's its greatest strength. The mind is actually a really great pattern recognition vehicle. For example, you see this glowing, warm yellow stuff in front of you as a baby. You reach out and you feel horrible pain. Guess what? Next time you see this glowing, fiery thing in front of you, you will likely not reach out because your brain says, hey, wait a minute, this might be a pattern. That's how we learn. We learn by recognizing patterns, by putting things in order in our heads, making neural connections. And what's worse, or what's better, because that's how we got here. If we weren't able to do that, we would still be like every other animal out there. But what's worse, if you want to innovate, is that our minds recognize new stimuli based on existing metaphors and frameworks. So Ford, supposedly, although I don't think he ever actually said this, said that if I had gone out and asked my customers what they wanted, I would have had some kind of fancy carriage, not a car, because they did not know that a car existed or would or could exist. Their minds were in a particular paradigm, metaphor of transportation. They would have asked for a better carriage. That's why I said, if you know that someone doesn't like it, it may be a good idea, because most people like what they're familiar with. I met a CEO from IBM one time after he retired, and he said the way that he knew it was a good idea when his junior associates came up and pitched something was that if he hated it right away, because he knew that he was, established, biased, in a particular mindset. If he thought it couldn't be done, there was something there. If he thought it was a great idea right off the bat, that means it was something that he was already familiar with, felt comfortable with, and it was probably not novel. If this works, this will be fabulous. Is this computer not online? Okay. Doesn't work, I'll talk to you about it. I can just look it up. Have any of you seen this video?
Yeah, the only problem, the online participants won't be able to see it.
If we go off of that.
If we're plated here, yeah.
Okay, so let's try here. You have to be in the presenter mode.
Oh, yeah.
It's usually in the middle. Okay. It's all right. We can It's a great little video that you should see. This is by an engineer, and he basically says he loves the welders that he works with, and they challenge him all the time. And what they did one time was they built a bicycle for him to ride, and they challenged him. And all they did was change the directionality of the steering. When you steered one way, the wheel turned the other. And he spent 8 months trying to ride this bicycle. And he could not, until at one point his mind clicked in and he was riding it. And he makes the point that it has nothing to do with coordination, because he juggles and he's very coordinated. And he took this bike across various presentations, universities, tried to pay people money to ride this bike, and nobody could. Because all of our minds are hardwired to perform very specific tasks in very specific ways. You change one of the factors of the underlying algorithm, and we have to get over that cognitive bias, relearn that, or replace that cognitive bias with something else in order to function. And riding a bike is not that easy. It's actually a very complex process of balance, of muscle movements, of responses, of fine-tuning as you go. And you change one variable and you can't. Now, his kid, who was, I think 3 or 4 or 5, took about 8 weeks instead of 8 months, or 4 weeks, but he was around 4. So the point is, and he talks about, is neuroplasticity, that as we get older, it becomes much harder for us to actually think outside the box, to think differently, to be creative. So we need to find ways and structures of helping us to do that. And at the end of the video, which I highly encourage you to take a look at, because not only is it fun, it's also funny, he then goes to Amsterdam and tries to ride a regular bike, and he can't ride it because he has rewired his brain. Now, fortunately, it takes him about 24 minutes or so to snap back into the regular sort of what he knows. But the point is that we need something like ideation, a formalized process of creating ideas and concepts in order to allow us to understand how we can make something different. Okay. Does that make any sense? You have no idea what I'm talking about yet, do you? Okay, let's talk about how. This, so I guess context. So in my day job, one of the things I do is teach. I run a program on translational research. The idea is, how do we take science, scientific concepts, and translate, which is a really bad word, but not mine, those concepts into innovations, tangible benefits for people. And it's not as easy as you might think. Having a discovery in a lab, having a discovery somewhere is not the same as actually being able to use it on patients. It is not the same as convincing physicians to use it. It is not the same as having a drug on the shelf and having people purchase it. It is not the same as having patients stick to a routine of taking that medication at effective intervals in order to get its benefits. There are a lot that has to go in to taking a, for example, compound, since I'm sticking with that vein, and making it into something that actually has benefits for someone. The problem is that by definition, if you are innovating, you are doing something new or in a new way. And therefore, there isn't a proven way to do it. If there's a proven way to do it, then you are probably not innovating. The best we can really have, if we need to do this systematically, and don't get me wrong, this has been done a lot by a lot of people over a lot of years. Mostly by trial and error, sometimes by more systematic processes, but rarely as an activity. Except since the 2000s or so, there's been this dialogue within medicine and health sciences about how do we actually do this. Part of the issue has been is that we've become so specialized. We need so much deep knowledge to understand specific fields that those people that spend 18 years digging down into one molecule or one process find it very hard to then think broadly or to take big risks like, oh, I'm going to abandon my career that I've spent 18, 20 years studying for and perfecting because I'm going to go out and try and start a startup for 18 months and maybe fail and then have my career dead. There's a lot of disincentive for us to do this. So what we have done in our program is started thinking about, well, how do we actually do this more systematically? And what you see here, and this is what we're going to be doing a little bit later during the workshop, is we are actually going to define a problem. Our problem is going to be, or your challenge is going to be, to rethink the hospital bed. And there are many ways that you can approach this. You can look at the domain of what is the purpose, the need for a bed, or you can look at the bed itself. So right away, it's about restructuring, rethinking the problem in terms of positioning it in different ways. Then what we're going to do is we're going to structure this ideate part. So ideation includes brainstorming. Who has ever done brainstorming? Okay, we have people across the room. What is brainstorming? Just speak up loud. Okay. Anyone else? Okay.
Connecting your topic to other things you know or experience.
Okay.
It's not a very active thing. You're trying to put down whatever kind of relevant might not be relevant enough. That's kind of this. You're trying to put down whatever it is.
Well, it's interesting. So that's great. It's not active thinking. It's putting down whatever comes to mind, but you're already, by talking about it that way, you're framing it as a very rigid activity. Okay, that's sort of the point. So Osborne in '54, who was looking at management and looking at teams, looked at or proposed a method for coming up with ideas. And you're absolutely, all of you are right, and we've all been doing this at various iterations. People have picked up on his original work and changed it and added it, but no matter what literature you go through, you see there are some basic characteristics. The number one characteristic is quality is subservient to quantity. If you want to have effective brainstorming sessions, the first thing you've got to do is defer judgment. You cannot judge the quality of the ideas. And that is really important. Why? I'm not a very good lecturer, just so you know, like I need conversation, interaction. I don't like lecturing.
Well,
So-
it's just like you said, almost the first ideas that you hate are almost the best. When you hate something, you automatically judge.
taught myself the issues with scope. So you're putting down ideas, they might be very ambitious. I tend to put them down right away. I'm like, oh, maybe I don't have funding for this, maybe I can afford this. That could be a brilliant idea.
Doesn't it also kind of be considered as like a box, or box, premises and what should be considered as good, what should be considered as that.
Okay. All of those are excellent points. Think about it this way. Did you have, sorry, in the back. Think about it this way. And actually deferring judgment has at least two very important things. The first one is if we assume that we all have our own cognitive biases and our own sort of ruts that we're stuck in, we are going to react in particular ways, right? It sort of makes sense, it follows. Those reactions are going to steer towards the predictable, the things we are comfortable with. By asking yourself and trying to defer judgment, in a sense, you are trying to step outside of yourself. You are trying to defer what you know and try and just let things happen. What's creativity?
Outside of your judgments and biases.
Okay, and how do you do that?
I think you have to foster positive environments of creativity to come out. And so I think that's a great point. By moving things like judgment, create a more positive environment. People are more willing to contribute directly.
Okay. So if you think about creativity, creativity is essentially thinking differently or recognizing different patterns that exist. When you see artists and you see fine art, and there are probably slides later on, you think, oh my God, this is art, because we're told what art is. But really creative art is what gets you to think and shift. And it doesn't happen overnight, and it doesn't happen in isolation. It works with other things. We see the end result of an artist's work that could have taken years and years and years to be creative. Artists practice creativity. So creativity is itself within a system of thinking for artists. If you're going to have that system of thinking, you need to first defer judgment. Now, and you're absolutely right. Deferring your own judgment is one thing. Deferring judgment of others is a second thing. So this is the second characteristic of brainstorming that we talk about, is it's usually done in groups. You have your ideas, your mind works the way it works. When you put your mind in with other people, preferably people who think differently. So if you put a bunch of physicians in a room and ask them to solve problems, the chances that they're going to have similar or related solutions is pretty good. If you put people from different disciplines in a room and ask them to solve the same problems, the chances that they're going to have more diverse solutions is much better. Different perspectives build on each other and take you in directions that you don't anticipate if you let it happen. But in order to happen, you need to first allow yourself to defer judgment from your own ideas in terms of what I'm going to let happen and judgment of others, because if they feel that you're going to just shoot them down, they're not going to work. And in fact, brainstorming isn't the only way of generating ideas. Now there are other techniques like brainwriting. Brainwriting is where people write ideas on a piece of paper in order to then pass them around the room to allow people that aren't as extroverted, for example, to equally participate in the process of deriving new ideas. It also allows you to sort of have more time to think about it. Not everybody just shouts things out. Some people need time to reflect. So there are different approaches, but the goal is quantity. Brainstorming is about quantity, period. In order to get quantity, you need to do things like a positive environment. Where you do brainstorming matters, who you do brainstorming with matters, but also how you do brainstorming matters. So in your groups, when you're by yourselves in your work teams, you can have different processes of how to brainstorm together. It doesn't matter. You don't have to follow one routine. What works for your group? You need to figure that out, and that is by practice and, you know, working together. Brainstorming then generates the ideas, potentially. Good, bad, or other. You need to have constraints. That's the other really, really important thing, is that you can't just say, okay, we're going to brainstorm for the next 5 days. Constraints are a really, really, really important aspect of creativity. If I ask you to come up with an idea right now, it's very hard because there are no constraints, no direction, no box. The second you start putting constraints, well, you have 5 minutes to come up with a better bed. It gives you a space within which to work. So brainstorming requires process, it requires rules, it requires constraints. It is not about free form, but so is creativity. That's the point. Recognizing patterns, coming up with brilliant art does not happen like a eureka moment with a lightning strike. People work at it. Edison, have you guys heard that famous Edison quote? One or two people, that Edison didn't fail. He just found 1,000 ways of how not to invent the light bulb. He actually sold the light bulb 3 years before he had a working prototype. During those 3 years, he had over 1,000 tests of different materials, different ways to position it until he was able, not he personally, but his lab, make something work. But rather than seeing that as a stumbling block, he saw that as an opportunity to learn from each iteration. And that is sort of what we're going for. What makes ideation different than brainstorming is that I apologize online. What makes ideation different than brainstorming is that ideation is a further process. Once you come up with 100 different ideas, then you have to start picking and choosing and narrowing them down. Convergent thinking. Then you have to filter. So which ideas are feasible? Which ideas you can have a business case? Which are desirable? You can have, for example, if you wanted to get rid of sick patients in hospitals, you can murder everybody in the hospital. That is an idea. It may not be a desirable idea. It may not be socially or politically feasible, but it is definitely an idea. The point is, once you have brainstormed ideas, then you have to start putting them into a filter, starting to pick out which of those might or might not work. And you may have some ideas that you have no idea whether they'll work. So you're going to have to go out and research and frame and understand, and you're going to have to look at the constraints. How much does it cost? Do people like it? Do people want it? Can you reasonably make it happen? What's the timeline? If you are going to solve somebody's problem, but it's going to take 40 years, but they want to wait a week, it's not a good idea. So then you need to start processing. And there are many filters. You can look it up online in terms of ideation, selection. There are lots of filters that you can use. The most easy one is this desirable, the three things. It's basically, is it technologically feasible? Is it financially feasible? And is it socially feasible? So will people use it? Can you manufacture it appropriately? And can you make money at it? That's one way. If you're not designing for a company, but you're designing for, or you're doing this to solve a problem, finance may not be the primary concern. It may be that whether or not people will actually use what it is that you're proposing. And so then you may want to engage other stakeholders, patients, people that work with you in order to help you select. So that is sort of the next stage is codify. Once you start refining the idea to something that seems like it's going to be interesting enough to investigate further, you need to codify it. And what I mean by codify is that you then need to go to the people who might be using it, the stakeholders who might be involved, and ask them, is this something that sounds interesting? Is this something that solves a need? You need to verify that your idea solves the original gap or the original problem that you were going for. Because if it doesn't, it is much, much more effective to stop right there and go through the process again than to continue building something that doesn't meet the need you're trying to solve. So you need to go back. Ideally, if you can, invite the patients, invite the people to co-design, co-develop with you, sit in the brainstorming sessions so that they're part of the idea generation if they can be, so that they're helping to select the ideas. And so when you start formulating and codifying your ideas into what you're going to try and do, they're there to help guide you. That's lean startup methodology essentially in business these days, is you co-develop with your customers. The patients may not be your customers. The physicians may not be your customers. But in health, you have needs and gaps you're addressing, even if it's Ontario government that's paying for it or an insurer. There are going to be needs that the physician or the patient or the procurement officer need to meet in order for your device or your solution or your intervention to be bought by somebody and to be used in a hospital or clinic or even the community. Once you've verified and codified the next steps, developing it, right? Prototyping it, that is a whole different ballgame. And that has its own challenges. But the process very much is iterative. And so what we are going to do this evening, for those of you that are sticking around, is we are going to look at the hospital bed. And we are going to run several brainstorming sessions. We are going to look at generating as many ideas as we can. We are going to deconstruct how we think about those ideas. So some people call this fractionating, figuring out how do we break down the problem into component parts, looking at the domain of the problem as well as the structure of the problem itself. Then once we sort of break it apart, we're going to look at individual pieces and say, hey, can we address this? What can we do? That's referred to often as reframing the problem. You can reframe the problem, and then we're going to brainstorm again about how to address the specifics of that problem that we've generated. And based on those, we're going to select and we're going to make conceptual prototypes, just ideas of how to solve our bed problem and innovate. It is honestly a very, very obvious and very simple problem, very simple process to tell you about. The devil is in the doing, because you can learn from any textbook, in my opinion, about how to do this. You can learn a dozen different techniques with one Google search easily. But until you actually sit down with your team and present a challenge and work through it and practice and find how you guys groove together, it's all academic. I say that because I'm an academic, and that's not a good thing usually. So this is one area where the best way to learn is to learn by doing. Are there any questions? Have I answered some of your questions?
I kind of hung up on this, but how do you put your mind on a way? I know it's not to be judgmental. You almost hear somebody say they have an idea about this pet first. You want to say, well, you can't do that. It doesn't make any sense. But you take the advantages from their idea and then disadvantage and then state it. How do you?
So one way, and you look up IDEO, a company that does this for business, and they're the ones that copyrighted the design thinking methodology for this, which is really borrowed from other methodologies, we can talk, is that you use the words and instead of but. That's a great idea, that, you know, smearing poop all over the floor, and we're going to use diapers. So believe it or not, the restructuring the way you talk about something in a positive way, you start building onto the ideas. I see this all the time. I spent time with my groups that are doing capstones right now. And the worst offenders are the most educated, the most entrenched, the people that have been doing this a long time. The first thing they say, you can't do that. You can't do that. Oh no, we can't do that. Today we were talking about figuring out whether or not we could use sort of commercial DNA tests to look at rare diseases and whether that would help with diagnosis. And the person that has spent the most time in this sphere, the most knowledge about genetic counseling and genetics, the first thing was, no, you can't do it. Why not? Well, it's not done before the tests aren't available. Well, if the tests aren't available, that seems like an opportunity. But the first thing is, because she's so embedded in the way things are done, right away, no, you can't do that. If you are going to generate ideas that you will have to test and select from later on, you cannot shoot anything down, because you don't know which idea will stimulate something in someone else's mind. Plus, you don't actually know yourself that it's not innovative. Just because you think it's a bad idea based on your experience or that it can't be done, by shooting it down right away, you know it won't be done. The problem isn't, it isn't about whether it's a good or bad idea at this stage. It's about generating many ideas. Making them work is later on. The development, taking out the bad ideas is later on. The selection. But if you are right away, your gut is, let's shoot it down, you could be shooting down the next idea, the next car, because you're comfortable with a carriage. So the deferring, it is hard, absolutely hard, but there are techniques, and we'll be practicing one tonight in terms of how do you get your mind around that. essentially tricking your mind. And it's practice. But we all do it. That's the problem. That's why the human mind is our worst enemy when we're trying to come up with something new and totally original. We don't think like that. Does that sort of... It's not easy to just tell you that's the way to do it. You have to actually participate and try it. I know I'm not trying it as a cop-out, but it is really like, it's one of those things that I can tell you, but until you do it yourself. It's Aristotle, you know, used to say that the best way of learning something is by doing it. And it's 2,000 years later, and don't know that he was wrong. Anyone else? Tough room. This is all easy here. You totally make sense. Look, this type of thinking is hard, specifically because we are trained not to think this way. Everything about our school system, our way of education currently, is the antithesis of what I am telling you to do. We teach people to judge, to assess, to assign marks. We are not about skill development or thinking creatively. We are about getting our kids to memorize 50% or more of the material so they can move on to the next level. Because nobody's really stopped to think about the fact that if you only remember 50% at one level, and then 50% at another level, and then 50% at a third level, how much are you actually retaining or building on? That type of education is useful when you are dealing with industrial processes, linear processes, additive, repetitive processes. It is not as useful when you're trying to think of nonlinear processes, making wild associations, when you're trying to think about how to solve problems in ways that are not easily anticipated. So, how many here would describe themselves as scientists or science-oriented? Math, engineering? Okay. Good portion. Maybe one, the guy typing in the front is not self-identifying. How many of you have heard that there are 3 different ways of thinking? Problem solving. So the first one, deductive. Anyone heard of this before? Deductive reasoning. Nobody's heard of it. This is really sad. University. One person in the back, he just joined us, so he hasn't been cornered yet. Okay, he heard. This is Sherlock Holmes, right? You take clues and you deduce the answer based on where the clues are leading you. Inductive thinking. What is that? Come on, you scientist-ish. You take clues and what do you build? Not a singular particular. Inductive reasoning. Sorry? That's right, a theory. A scientific theory about the way everything else works. It can't be fact because you don't know every single thing about it, but that's the way of thinking. You think you've seen enough of a particular thing, and now you're going to make a general rule about it. How many in the room have heard of those 2 ways of thinking? 1, really our school systems are failing us. Well, there's a third, abductive thinking. Who has heard of abductive thinking? Just for those online, not a single one has raised their hands, even the one that was raising his hand before. Abductive thinking, what is that? move it. Okay, so you're trying to think it through based on your, great, awesome.
I guess and say it's a hybrid of both.
The guess part was good. It's not a hybrid of both. It's, nope, it's guessing. In the absence of information, you guess. And that is a perfectly legitimate way of thinking. And you know what? In science, it's used all the time. Do we talk about it? Do we teach people how to do it, to be comfortable with it, to think, okay, if something is not working, try and guess, figure it out, what's not working. Even if you don't really know, sometimes the guess is better than stopping. But it's not the way that our system has trained us. We need to feel like we need the absolute answers. Part of that has to do with this assessment, being judged, getting that A. We're not focused on, and you're gonna love this word, those of you that are in medicine, we're not focused on competencies. We're focused on the assessment. But if you are being assessed, you start psychologically, there's lots of ways that you avoid being judged. People don't like being judged. And being assessed does not mean that you understand what you're doing. So these are skills that you actually have to try and you have to get comfortable with. Guessing is okay sometimes, not if someone's life is at stake, but when you're dealing with a problem and trying to find a way around it, sometimes having multiple guesses of ways to go can lead to another guess that will actually work. Or when you test, will lead to a different iteration. And when you are being innovative or trying to problem solve creatively, that is really an important technique, because if 100 of your guesses fail, if 1,000 of your guesses fail, but that one produces a light bulb, they'll call you Edison. So think differently. Think systematically about thinking differently. Defer judgment. Generate as many ideas as possible. Select from those ideas the ones that are most likely, and systematically start testing them with the people that are involved, the stakeholders. It is not rocket science, but it is slightly better, even if it's just slightly better, than complete trial and error. Because that's generally the way we do things. All right. Any questions, comments, concerns? Honestly, take a risk. Think, do with your groups that you work with, try things that feel a little uncomfortable. That's the only way you can make change, because if it is comfortable, it's known, and it's not novel, and it's not innovative. Thanks for listening.